joint axons bundled together. These axons itself are covered by a myelination, Schwann cells or something, they're covered by that. On top of that, they have a layer called the endoneurium. So they have a first layer, a covering endoneurium that surrounds those axons. And then the groups of axons together form what you call the fascicles. Fascicles are bound together by another membrane. We call that the perineurium, right? So perineurium covers up the fascicles. All these fascicles together form a nerve, and between, they have connective tissues and arteries and veins and fats, and all these things are there within the nerve. But all the fascicles together has another outer covering or a layer called the epineurium. So all of those endoneurium, perineurium, epineurium are sheets that cover each unit, axon to a fascicle to the whole nerve. So that's how we get a nerve. In short, that's just the structure of the nerve. So look at the figure in 11.10. So there are 31 pairs of spinal nerves, 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. I kind of said that before earlier too, so I want to expand on that. In your textbook, you'll see that there are pictures, dermatomes, that is on page 308, 11.12, you'll see some dermatomes. They are spinal nerves, have specific cutaneous distributions, and we call those distributions dermatomes. It's very common, even when you go shopping, in many products these days, you'll see a dermatome there, showing this is the nerves, this is the areas it hits, like shoes, or when you go to massage, you'll see dermatomes. So that kind of tells you which area of the body, which nerves are innervating within that. So take a look at that picture as well. So the cervical nerves, basically their function is, moving the head, diaphragm movement, neck and shoulder, even upper limb, all those you see the cervical nerves are doing. Thoracic nerves, they move your ribs. When you're breathing, for example, you use your muscles within your cage, so to take it up and down. So those movement, rib movement in breathing is thoracic nerves. Vertebral column movement, tone in postural back muscles, all of those, even hip movement, you have a lot of those thoracic nerves. Lumbar nerves are usually hip movement and lower limb movement, and also sacral nerves do a lot of those lower limbs movement in there. Spinal nerves branch to form rami. So when you look at the picture in 11.13, you'll see there's this spinal cord. You have this roots coming out, 2 roots from each side, which we call the dorsal root versus the ventral root. So dorsal root and ventral root, all of these roots divide into your dorsal rami and ventral rami. So dorsal rami supply the muscles and skin near the middle of the back, while the ventral rami in the thoracic region form intercostal nerves which supply the thorax and your upper abdomen area. So look at that as well in the picture. You have dorsal and ventral rami. Cervical, lumbar, sacral, coccygeal, ventral rami join to form plexuses, and we look at plexuses in the next figure. So when you look at figure 11.14, there's the picture shows a brachial plexus. So look at that. There are actually 5 major plexuses. You have the cervical, brachial, lumbar, sacral, and coccygeal. Cervical plexuses, those are your C1 to C4. One nerve from your cervical plexus is your phrenic nerve that you should remember for the quiz and for later. And then you have your brachial plexuses. You have C5 to T1. The 5 nerves you should know from here are your axillary nerve, radial nerve, musculocutaneous nerve, ulnar nerve, and your median nerves. All of those are your brachial plexus. It's in your area here. So if you want to numb down your upper arm. If you want to put an anesthetic, it's usually they put it in the brachial plexus over there. Then you have the lumbar and sacral and coccygeal. We usually call that plexus lumbosacral plexus. And the four nerves to know from there are obturator nerves, femoral nerves, tibial nerves, and common fibular nerves. And then we look at a structure of your brachial plexus. Plexuses start off with the roots. So in the case of brachial plexus, you have C5, C6, C7, C8, and T1. Coming out from the spinal cord is roots, connecting in an area called the trunks, where you have the upper, middle, and lower trunk in there. The trunks again branch out into your anterior and posterior divisions. Anterior and posterior divisions again join into cords, where you have posterior, lateral, and medial cords that give rise to the major branches of your brachial nerves: axillary, radial, musculocutaneous, and medial, all of those. So axons from different levels of the spinal cord intermingle within plexuses and give rise to nerves that have axons form more than one level of spinal cord. So that was your brachial plexus for figure 11.14. Also, there is another figure, 11.15. You'll see how one nerve, this radial nerve, goes all the way down, and look at how many muscles it's innervating in as its effector organ. So many of those muscle names, so you do not have to learn all of those, but just look at it. Just get an idea of how it works. So nerves arising from plexus are distributed to skeletal muscles throughout the body in there. Nerves arising from plexuses also supply the skin, and that you can take a look at the figure here, 11.16, to all the areas of the skin that the nerve innervates. There's a table that you have to learn. This table summarizes all of those nerves in all of the spinal nerves. So you have the table 11.1, page 312. You have the three plexuses and all the associated nerves and the muscles, the innervate, and more things there, major movements, distribution, all of those things. So know those nerves under those plexuses and also some of the muscles. Know some of the muscles and that they innervate in there. One of the nerves there in your textbook, you have the phrenic nerve. Very important to know. This nerve is innervating your diaphragm, muscles of the diaphragm, so it's involved in breathing. When your rib cage goes up and down, that's your phrenic nerve. So it kind of controls the thoracic volume. When we go to respiratory system next, NP2, we'll learn that. Brachial plexus, you have all this 5 nerves. You have the axillary nerve, radial nerve, musculocutaneous nerve, ulnar nerve, median nerve. One of the things in radial nerve is, you have the axillary nerve armpit. So if someone uses crutch for a while, they can get what we call a crutch paralysis if you hit the radial nerve there, so that whole area will be paralyzed because you damage the nerve. So crutch can do that. Ulnar nerve is another nerve that we call, in your elbow area. For example, when you hit your elbow, against a wall or hard object or something, and you go like ding, like this feeling you get, like you can feel it all the way, like a tingling thing, in your elbow. That is caused because of temporary damage to your ulnar nerve right there. So, that happens a lot of times, temporary damage to ulnar nerve. Another one is like your median nerve. You have that in your wrist. When people try to, cut themselves, a lot of suicides you see, they usually cut the median nerve, and bleeding from that can cause death. So that's another nerve. Then you have the nerves of the lumbosacral plexuses, and you have some nerve, the obturator nerve muscles that usually moves the adducts the thigh and flexes the knee. And then you have the femoral nerves that's involved in, again, adducting thigh, flexing